Hello.
Hi, Doc.
Good
Good
afternoon.
afternoon.
Good
Yeah,
afternoon.
it's good to see
Yes,
you.
yes, good.
Ages. So, how are you doing today?
I'm well. Thank you. Thank you very much. And thank you
Okay,
for making out this time.
good to see. Anything.
Yes.
So, when I saw this topic on the group, right, it was
Yeah.
a mixed feeling for me. First of all, I was excited that, yeah, we get to do another health talk, which is really
Yeah.
important to me at this stage of my life. And I believe
Yeah.
it's the same for everybody because
Yeah.
we are growing older and we've come to that point
Exactly.
where we realize that we are no longer just children. So at this
Yeah.
point, we are what we know,
Yeah.
what we eat, and what we
Exactly.
use, right?
Yes.
So
Yes.
this left me wondering, okay, for real, I did not know that there's such a thing as endocrine disruption.
Yeah.
So it caused me to think, because of this, I have quite a few questions.
Okay.
I think that some other persons too hear the same question,
Yes.
but disruption. What is this? What does it mean?
Okay. Yeah. So, for the purpose of this lecture, we'll try to just make it as simple as possible so that everybody can grasp what we're discussing. So, let's first of all talk about the endocrine system. What exactly is the endocrine system? Now, the endocrine glands are scattered everywhere, all over the body. What is their function? They serve as the glands that will produce the messengers that will catch. So this is what happens. The brain wants something to be done. It sends a signal to the endocrine gland, and the endocrine gland produces this messenger, which are called hormones. So the endocrine glands are generally responsible for producing hormones that affect every part of the body. Okay, so this is a normal biological function for the body. This is what is normal. But then we find out that whilst you are doing this, just like in everyday life, let me look for a good analogy. Okay, so the Nigerian armed forces, let's say the army sends recruit soldiers now. They want soldiers and then they train soldiers in wherever or all over the country. So when maybe our waterways are going to be attacked, or there's this fear, or there's a signal that okay, there seem to be some insurgents along our coastal line, so they say okay, the Navy should do this. Let's assume the Navy wants to go to a jetty, or let's say they want to go to the coast of the country, and then somehow they are interrupted. Some bandits or some militants or terrorists try to stop them from getting to their proposed destination. So when the hormones want to get to the receptors, something stops them. Some other chemicals try to act like these hormones. They mimic the hormones. Sometimes they outrightly go to the gland and stimulate the gland wrongly, making the gland to produce too much of these hormones sometimes, or produce them at the wrong time. You understand what I'm saying? So these are disruptors. They are now endocrine disruptors. They do not want the hormones to act accordingly on the receptors. They actually go to these receptors sometimes to block the receptors, thereby preventing the hormones from acting. And also, they can also go to the gland and stimulate the gland to make these hormones to come out in excess. Because what the brain just does is it stimulates the gland, and then very little, just a minute quantity of that hormone gives us the effect we get. So for a woman, just a little stimulation, you have estrogen production, you have follicle stimulating hormone, you have luteinizing hormone. All these things play a role at a certain time every month. You understand what I'm saying? So now when you have these disruptors, when you have these disruptors, that's where the problem is. And the funny truth is, we cannot stay away from these disruptors completely. It is, I would say, impossible to stay away from them because they are part of our everyday life. But one thing we can do is, they are. One thing we can do is we can consciously modify our life in a way that we reduce our exposure to these disruptors. So endocrine disruptors now, so let's define them to be. Let's define them. Can you hear me?
Thank you very much.
Nice. Okay, so we have looked at we have just looked at what the endocrine system basically is and how exactly they function, and then how they can get interrupted by these disruptors. So we have to note this because as we go on, we will be now pointing on these disruptors and how they work, how they affect us, and how we come in contact with them every day. So you may want to ask again now, okay, nice. Where exactly can we find these disruptors? Since we say it's very common, it's everywhere. So what exactly are these disruptors within us? Okay, so truth about it is, like I said, they are everywhere within us. They are part of our everyday life. We come in contact with disruptors consciously or unconsciously, but we have to now make these efforts to limit our exposure. We can find many chemicals because we now pharmacology, toxicology has evolved to the point where we can now confidently say there are over 85,000 chemicals manufactured synthetically. So these chemicals are used for various purposes, and we come in contact with them somehow as we go on with our daily lives. Out of that 85,000, about 1,000 of them are disruptors to the endocrine system. We may not know them. Truly, we may not know them because it's not part of what we look out for every day. So where can we find these disruptors? In agricultural sector, industrial sector. They are part of our home. They reside with us at home. Some of the things we use at home are part of it. You can also find them in pharmaceuticals. And they are part of the lotions, soap, everything we use at home as cosmetic beautification. So you can find out now, and you can agree with me that some of these things we can't do without them. I've just pointed out some of the sources. Are you going to say you're not going to use body lotion? Are you not going to use your soap again? Wouldn't you bag your food? Wouldn't you eat your canned food anymore? I mean, some of these adjustments you will make at the end of this lecture, but eventually you now know that it is with you, it grows with you. So this is the source. Let us now look at some of these chemicals we're talking about. What are these chemicals? What exactly? What are they? What are we discussing? What are these disruptors? Even if they do this or they do that, or really, what do we mean? Okay, so of these 85,000 synthetic products that we have been able to identify, more are being discovered anyway. But of these ones that are disruptors, the minute quantity that we have known so far, some of them are bound in the agricultural sector. Herbicides, for instance, used to control pests, used to control weed amongst maize plants, sugarcane plants, this large-scale farming. These herbicides we spray. Some of them contain atrazine. Atrazine is a very, very strong component in herbicides, and it's a major disruptor. Atrazine has I'll give you some of the effects that they have. Another one is bisphenol A, BPA. Bisphenol A is used in the manufacture of plastics. Plastics are these packs we use to put our food, like children toys, anything plastic, something that is elastic, something that that can serve expansion purpose. We use bisphenol A in manufacturing it. That's one disruptor as well. We also have dioxins. So in the manufacture of herbicides, then industries get to burn some chemicals, and then dioxins are released into the air. Dioxins are also very, very potent endocrine disruptors as well. We have more, like the drug that we used in 1940s, used for about 30 years, 1940 to 31 years, 1971. There's this drug. Okay, welcome back. So it was used in the 1940s. That at that time it was one of the best drugs to control miscarriage and to encourage the progression of pregnancies. So diethylstilbestrol was administered very commonly between the 1940s to 1970s. So later on, we now found out that that drug, though it was potent, the afterward effect was more deleterious than the benefit, especially when there were alternatives being manufactured. So it's now known that diethylstilbestrol, even though we're not using it anymore, it is a very strong disruptor to the endocrine gland. There are others like the perchlorate gas and salt rather. Perchlorate salt found in groundwater is a major disruptor. There's still this PFAs, that's the polyfluoroalkyl substances. Those are also found we use them in manufacturing plastic children toys. So those are major disruptors as well. And you also find them in cosmetic products, nail polish. You find phthalates in nail polish. You won't be surprised. Yeah, you find them in nail polish, cosmetic products. You have a lot of them there. So, and some of them are even part of our food packaging. Yes, they are part of our food packaging as well. So you agree with me now that they are everywhere. They are everywhere. Even the toys your children use, they are part of it. Yes.
Sorry, I'm just a bit surprised. So actually, I would have thought that because we're talking about crime, disruptors will probably be just genetic. And here you are telling us that external factors such as food and even things we apply on our skin. The endocrine. That's
exactly.
So let me ask this. Are these disruptors?
Sorry, I didn't get the question. I did what?
Did you hear me?
No, I didn't.
Okay. Are the disruptors avoidable? Is it for us to avoid this endocrine disruption?
Yes, and no. So I'll give you instances. So some of these disruptors, like I just moved on, some of them, let's say the PFAs, that is the polyfluoroalkyl substances. Now, PFAs, for instance, are contained in fire extinguishers. The fire extinguisher, the foam fire extinguisher. So now PFAs, I would not say you shouldn't use fire extinguishers, because in firefighting there are different kinds of extinguishers, but you must recognize the fact that this is a component of this product. And knowing that already at the back of your mind, it already now sends this signal to you that I should be very careful dealing with this. I shouldn't just take it as a normal thing. Also, atrazine, is part of the herbicide. You have to be very careful now when you're going to use herbicides on your crops. You'll be very careful with that. Now, we've also talked about these phenols and how they play a role as plasticizers. So you don't want to save your food anymore in plastic containers, because some of them get through to what we ingest. So you can change to alternatives like glass reservoirs. You can change to steel reservoirs. Those can serve the same purpose as plastic. But sometimes we can't avoid them. We use them in pharmaceuticals as well. Manufacturing plastic tubings like catheters, NG tubes, they are all part of it. We can't stay away from it. So we don't have alternatives to these tubes. So that's why I say yes and no. So sometimes we may be conscious of this fact, and then we don't want it to stay too long. But you'll be surprised to find out that a little quantity of these disruptors, just as the hormone would act, can produce very harmful effects. So it was discovered that in some research work done, children who suffer this attention deficit hyperactivity disorder, they found traces of disruptors in their urine. They found some traces in their urine. Some children have also been, it was in their urine, and it's you cannot rule out the fact that these children present with this complaint. These children lack focus. They're always here and there and everywhere, and their teachers are always complaining, but you don't know. So, and then you now carry out a study on them and find out that you start finding phthalates and you start finding DS in the urine of girls. So these girls now, we now discover that those ladies who were giving the dietary silvesterol, their granddaughters now are coming up with these disruptors in their urine and in their blood samples. So you can see how it has lingered, because dietary silvesterol now is now switching on and off genetic components in these girls. Their mothers are now suffering the effects of this drug with their grandmoms too. So the first generation of twins, many of them are coming down with very common reproductive cancers, breast cancer, uterine cancer, pancreatic cancer. So women who were exposed to these drugs, they necessarily didn't come down with them, but their daughters are coming down with them. Their granddaughters are now suffering from these attention deficits, hyperactivity. Then children who have diminished response to immune vaccination, we found out that the immunity in these children who are exposed to these disruptors is significant. So it's another worry.
My God.
And it's something to note. Yes. So you begin to wonder, my child or my grandchild is not getting this vaccine. Is it the vaccine that is fake? But other children take the same vaccine, But you find out that more studies carried out is proving to us now that this exposure exists. And these are some of the effects we may not take into cognizance, right? Okay, it also affects metabolism in the normal biological processes. So even there's a study now going on trying to link some of these disruptors with diabetes, obesity, and so on. This is a continuous study. They have also been linked to preterm deaths. They're now linking it to the fact that women who are generally exposed, but women will be exposed because you have disruptors in your nail polish, you have disruptors in your hairspray, cosmetics, you have heavy metals in soap. Some of these things, we just say them, but can you do without them? So we have to face these realities.
Wow.
We have to face these realities. They are there with us. You now have disruptors making girls to attain puberty faster, and you have that now you see disruptors causing girls to make the breast to start forming faster. You have boys now forming breast, because of disruptors. And then you have, like I said, these switching on and off genetic components causing infertility in more women and in men. Disruptors can also do that. Yeah. So you see, it spans all through the entire biology of the body. We take it for granted because we do not know, or because we do not take it serious enough. All right, we don't take it serious enough. But then they are a major part of our everyday life.
So I would say this has been really enlightening, and
Yes.
I appreciate the time you have taken out to educate novices like us. In layman terms, not medical terms, what I have learned for today is that these disruptors we're talking about are things that stop the endocrine glands from getting to the places where they're supposed to get to on time. And when this happens,
Yes.
many different things that you've covered here. The
Yes.
factors external, they could also be genetic. The most interesting thing that stood up for me is that external factors could eventually be genetic factors after it has passed on from one generation to the other. And guess what surprised I am to find out that endocrine are also related to ADHD. Like, this is mind blowing for me.
Yes.
I want to say at this point, thank you so much I've come to see how that, yes, truthfully, we may not be able to avoid all of it. However, just knowing will position us better to know how to handle ourselves.
Yes.
With this said, trust me, I'm looking forward to Sunday, and I trust that you're going to teach us so much, because if we let you go on, like you finish this whole lecture today, I'm super
exactly. We
excited.
will have enough time to break it. Yes. But on Sunday, hopefully, we'll have a larger body, and then we'll break it down and discuss together. The pleasure is mine. Thank you so much.
Yeah. Right. Oh, well, thank you. We look forward to your class on Sunday. Bye for now.
Thank you. All right, bye then.